Will now come to order, and I do detect a quorum. So we have one bill on the agenda. It's BL 2019-1493, Virtue and Withers, the sponsors. I see Councilman Withers here to speak on behalf of the bill. Approves a contract between the Metro government and Concentra Health Services Incorporated for the provision of medical services to employees who have sustained occupational injuries. Do I have a motion?
So moved.
Second. All right, second. Brett?
Just appreciate the interest in the bill. The gentleman is here to discuss it in more detail. We had a robust discussion in the Personnel Committee. My council colleague, Councilmember Murphy's very well versed in employee benefits and IOD, injury on the job matters from her private practice, and asked a lot of really great questions, was very satisfied with the answers, and so we recommended approval unanimously in personnel. If you have any specific questions, I'm sure the gentleman would be happy to answer it, but request your approval.
Any discussion? Any comments from, any questions?
I mean, Steve totally is our subject matter expert, but any of us are well versed in any of this. This is a very good program. I mean, this is something that we put in place in 2013. I got to actually pass the baton to Steve when I came over here to support you guys, because the IOD program was something that I had managed for the 10 years prior. But the IOD clinic is just triage for initial care, right? To kind of say, this is what's wrong with you. The little things that they can do there, they're going to take care of there, and it's one fixed cost. It has been a very successful program in reducing cost and getting people to direct specialist care much more quickly. So we've been able to reduce cost over the program, and it's ongoing cost every year, probably upwards of, and this is after expenses, because this paying Concentra is not a money-making thing for them either. The expenses are right around $800,000 a year. About 90% of that is staff. The rest are labs, office supplies, those kinds of things. So it's not a moneymaker for Concentra, but it absolutely is a massive cost saver and very efficient for the employees who are injured on duty at Metropolitan Government as a triage. So it's saved $2 million a year, and those are ongoing savings as long as we're keeping the clinic open. And we have a 98% satisfaction rating with employees that go there.
Ongoing savings and no deterioration in the quality of the care they receive?
Not at all. In fact, it's been going slightly up. I think I reported satisfaction numbers to you all last year in my budget hearing of 96 or 97%, so it's actually going up a bit. But it's, I hate to admit it, I was a little skeptical about this model. It's really paid off. It's been a very good fit for Metro and our program to help curb some of the costs. And if you have a fixed cost and you don't have to be paying those claims, it's great.
If I can, about 15 years ago, I had a work-related injury with my hand, and at a former employer. And if they had paid attention sooner, it wouldn't have gotten as bad. I'm sure it was expensive for them to. I had to have a bone removed and totally learn how to use my hand again, just from using the mouse wrong, right? And so I appreciate anything that can help people get well before they're worse, right? So I personally respect that opportunity. So, yeah.
Yes, ma'am.
So, Metro General, is there some reason why Metro General is not utilized for this particular service?
Triage, for initial triage. So this is a procured service. This is kind of unusual that you guys would approve a contract that's been through a procurement process, but it absolutely was procured. General chose not to bid these services. I suspect it's because, again, this is not necessarily a cost-making measure. The great part is that the real cost of IOD care beyond the triage that initially happens is with our network providers, and General is absolutely one of our network providers. Mm-hmm. So we make sure that all employees have a choice of any network provider. We absolutely let them know that General's in the network, and when they go to seek ongoing care for more specialized care, because again, this is just a triage kind of component, then General gets the benefit of getting 100% of billed charges directly from Metro. So they're in a good position.
But do they use it? I mean, I know that they're in a they may be able to benefit from it, but do the people use it, and especially our Metro employees?
So I do think that employees use it, but they do have a choice of a pretty large network of providers. I think the fact that General is not a complete full-service hospital may limit their ability to get some specialty cases like orthopedic, which tend to be some of our injuries. But I don't think it's for lack of care or lack of trying by General Hospital at all.
But doesn't General outsource those specialty services? I'm just trying to get more people into General, since it is the city's hospital and we are providing a subsidy for it, making sure that we're giving them every opportunity to build their patient pool.
Absolutely. And we feel the same way. I mean, we absolutely let people know that General is part of not only the IOD network. I would also say that General's been a really tremendous partner, specifically Kathy Poole, working very closely with our office to promote our employee incentive program for non-job related injuries. Mm-hmm. And I personally think that the way that they have structured that incentive program, General, again, their choice to structure it that way, is fair, equitable, and as employee-friendly as possible. And Kathy is a really great professional to work with to help promote that. We give her like front door access during all of our annual enrollment where people are coming on site and finding out about how to get courses of care. We don't really allow that access for anybody other than our carriers, but Kathy's been great to work with. It's something we continuously promote for both job-related and non-job-related. And to General's credit, and very thankfully so, I feel like they have an incentive program that is well-structured and very advantageous for employees to use and their dependents.
Thank you.
Any further discussion?
Good discussion.
Thank you, Councilman Withers, for being here to tell us all about this, and everybody else, you especially, Shannon. All in favor of this, moving this forward? All right, it's recommended for approval. Anybody got anything else you want to add before we close the meeting? All right, the meeting is adjourned. Thank you all.